Restless leg syndrome is a neurological disorder and is characterized by unpleasant or painful throbbing, pulling, or creeping sensation in the legs. Restless leg syndrome patients often feel irresistibly compelled to constantly move their legs, and these relentless symptoms can cause insomnia, emotional distress, and a significantly diminished quality of life. Restless leg syndrome can be classified as primary or secondary. The exact cause of primary restless leg syndrome is unknown, although altered dopamine signaling is thought to play a part, while secondary restless leg syndrome is connected to an underlying medical condition like diabetes, chronic venous disorders, and iron deficiency. Several natural interventions like diosmin and folate can help relieve the symptoms or the underlying causes of restless leg syndrome. Some of the causes and risk factors are a family history, kidney disease, diabetes or impaired glucose tolerance, chronic venous disorders, an iron deficiency or regularly donating blood, pregnancy, sedentary lifestyle, or obesity. Generally, restless leg syndrome is not treated pharmacologically unless it's chronic, persistent, and unresponsive to non-pharmacological treatments like correcting an iron deficiency and lifestyle changes. Also, treating primary restless leg syndrome should not be considered until possible secondary causes are addressed. Some of the conventional treatments are dopamine agonists, levodopa, a dopamine precursor, benzodiazepines, gabapentin, and low-dose opioids. You should avoid stimulants like nicotine and excessive caffeine. Exercise regularly, but not right before bed. Have massage and acupuncture in conjunction with medications or alone, as this can offer relief to some people with restless leg syndrome. Iron deficiency or altered brain iron metabolism has been linked to restless leg syndrome, and supplementation in this case would be recommended. Iron supplementation has been shown to significantly improve the iron-deficient restless leg syndrome patients. Low levels of folate can play a role in restless leg syndrome, especially in pregnant women. Pregnant women with low folate levels were more likely to develop restless leg syndrome than women who took vitamins during pregnancy. Low magnesium can cause excitability of the neurons. Magnesium supplements are often used to prevent abnormal activity in the nervous system. A case study indicated that magnesium can improve the symptoms and the sleep problems associated with restless leg syndrome. Diosmin is a natural flavone derivative often used for supporting venous function. Since venous disorders have been linked to restless leg syndrome, diosmin is a promising possible treatment. Diabetes and prediabetes are known risk factors for restless leg syndrome. Green coffee extract can help to maintain healthy glucose levels. Valerian, a herbal sedative, is often used as a sleep aid. In a clinical trial, supplementation with valerian resulted in improvements in restless leg symptoms and less daytime sleepiness. Other natural interventions that can help to relieve restless leg symptoms include D-ribose, vitamin C, and vitamin E. Restless leg syndrome is a neurological disorder and it's associated with impaired sleep, and it's characterized by throbbing, pulling, creeping, or other unpleasant sensations in the legs. Patients with restless leg syndrome often complain of an almost irresistible urge to move their legs, and this relentless and tormenting course of the restless leg symptoms often significantly diminishes the quality of life for many of those who are affected, and it leads to significant emotional distress. Sleepless nights and mental anguish contribute to a considerable physical and psychological burden for those who are affected with restless leg syndrome. Unfortunately, drugs used to treat the psychological effects associated with restless leg syndrome, such as tricyclic antidepressants and selective serotonin reuptake inhibitors, can trigger or worsen the restless leg symptoms. Pharmaceutical treatment strategies like dopaminergic medication can offer relief for those with the restless leg syndrome. However, a pitfall of dopaminergic drugs used at high doses is that quite often they appear to exacerbate the restless leg syndrome symptoms via a phenomenon known as augmentation or rebound. Fortunately, the 2012 approval of a sustained release transdermal gel could overcome this roadblock. Many people don't realise that restless leg syndrome can be classified as primary or secondary. Primary has no known cause, whereas secondary is related to another medical ailment. For example, secondary is often associated with high blood sugar, related nerve damage, or with chronic vascular disease like deep vein thrombosis or arterial claudication. The exact cause of primary restless leg syndrome is unknown. However, there does appear to be a genetic component, as approximately 40 to 50% of the patients with primary restless leg syndrome have a family history of the disorder, and certain genetic variations are associated with the condition. Although many think of primary restless leg syndrome as a disease of the peripheral nervous system, studies suggest the central nervous system might also be involved. Because restless leg syndrome is akin to some other movement disorders, the neurotransmitter dopamine, which helps to facilitate uniform controlled movements, has been theorized to be a possible causative factor. Indeed, altered dopamine signaling within the brain has been observed in several restless leg syndrome studies, but results have been insufficient to draw firm conclusions. Additionally, alterations in the dopamine signaling in the spinal cord have also been observed, and this leads further support to the hypothesis that dopamine is involved. Over 20 medications are connected to secondary restless leg syndrome. The secondary restless leg syndrome is a common complication of end-stage kidney disease. Estimates indicate that up to 60% of patients on dialysis have restless leg syndrome. People with diabetes or impaired glucose tolerance are more likely to have restless leg syndrome, and restless leg syndrome is a prominent part of diabetic peripheral neuropathy. Restless leg syndrome can also be associated with Parkinson's disease, another disorder associated with dopaminergic dysfunction in the nervous system. However, the link has not yet been clearly established. People with restless leg syndrome also have an increased risk of developing high blood pressure, possibly due to the overactivity of certain parts of the nervous system. Chronic venous disorders are a major contributor to secondary restless leg syndrome. In a 2007 study, researchers found 36% of patients who were suffering from chronic venous disease also had restless leg syndrome. In comparison, the control group only had a 19% occurrence of the restless leg syndrome. However, when the control participants who showed positive for restless leg syndrome were studied more closely, it was noted that 91% of them had mild indications of venous problems. In another study, participants with restless leg syndrome who received medical treatment for chronic venous disease reported a 36% increase in the quality of sleep and a 67% decrease in the severity of symptoms. One of the more commonly accepted hypotheses about the origin of the restless leg syndrome is that iron metabolism within the central nervous system plays a role. As many as 25% of restless leg syndrome patients have an iron deficiency, and iron supplementation was shown to relieve the restless leg syndrome symptoms in iron-deficient subjects. Another study found regular blood donors were more likely to develop restless leg syndrome, particularly if they had reduced serum iron levels. Intravenous iron relieved the symptoms in this population. Levels of ferritin, an iron storage protein, in the cerebrospinal fluid might also be reduced in patients with restless leg syndrome. Iron levels in the substantia nigra, a brain region where the dopamine is produced, may be particularly important, as a study using MRI imaging found reduced iron concentrations in the substantia nigra of the restless leg syndrome patients. Other studies have further confirmed an iron insufficiency in the substantia nigra as important for restless leg syndrome. Also, people suffering from restless leg syndrome often have abnormal levels of other proteins involved in iron handling. The main pharmacological agents that are used to treat primary restless leg syndrome are dopamine agonists, levodopa, benzodiazepines, gabapentin, and opioids. However, the treatment of primary restless leg syndrome should not be considered until all possible causes of secondary restless leg syndrome are first ruled out, especially venous disorders. Dopamine agonists are drugs that directly activate dopamine receptors in the nervous system. They are currently considered the first-line therapy for severe restless leg syndrome, and are typically less associated with augmentation or rebound than higher doses of levodopa. Several different dopamine agonists are used to treat restless leg syndrome. Levodopa serves as a precursor for dopamine in the body. It crosses the protective blood-brain barrier, whereas dopamine itself cannot. Once the levodopa has entered the central nervous system, it is converted into dopamine with the aid of pyridoxal 5-phosphate, the active form of vitamin B6. In studies, levodopa reduced the number of periodic limb movements during sleep, and it improved sleep quality compared to a placebo. Levodopa can provide relief within 20 minutes. However, it doesn't provide sustained relief for those with persistent symptoms. Levodopa and carbidopa is generally reserved for patients with infrequent symptoms because of the problems with the augmentation and the rebound. Therefore, the levodopa is recommended for intermittent treatment, less than 3 weeks at a time, of the bedtime symptoms, or as a prophylaxis during infrequent sedentary activities such as long plane trips, car rides, or a theatre event. Levodopa has a relatively benign side effect profile, though there's some concern that it can cause symptoms to occur earlier in the day and more quickly at rest, and spread to the upper limbs. Mucuna pruens or velvet bean is a natural source of levodopa. A pitfall of dopaminergic drugs is that, paradoxically, they may cause exacerbated restless leg syndrome symptoms, a phenomenon known as augmentation. As many as 20 to 60% of patients who are treated with levodopa or dopamine agonists develop augmentation, so it's important for physicians to carefully screen the patients for changes in the restless leg syndrome symptoms for as long as they're on a dopamine agent, with particular attention being paid to those who present with the most severe restless leg symptoms prior to the treatment initiation. Benzodiazepines enhance the effect of the inhibitory neurotransmitter GABA, giving them sedative, sleep-inducing, anti-anxiety, anticonvulsant, and amnesic qualities. These drugs are often useful for treating insomnia that's associated with restless leg syndrome. A small placebo-controlled study measured the acute effect of 1 milligram of clonazepam on sleep and awakening quality in 10 restless leg syndrome and 16 periodic limb movement disorder patients. Insomnia associated with both restless leg syndrome and periodic limb movement disorder was improved by the clonazepam. Benzodiazepines are sometimes combined with dopamine agonists in patients with refractory restless leg syndrome. These drugs can adversely impact the cognitive ability and the coordination, and they can rarely exacerbate the anxiety and the irritability. Gabapentin is a medication, and it's often used to treat epilepsy and peripheral neuropathy, and some studies have also found that it can be helpful for treating painful variants of restless leg syndrome. Gabapentin may be effective in individuals with restless leg syndrome that's associated with neuropathic pain that's not responded to dopaminergic drugs. Low-dose opioids have been used successfully in some cases of restless leg syndrome. However, the mechanism by which they provide the relief is not clear, and the role of endogenous opioid system in restless leg syndrome is complex. Opioids are typically reserved as a last resort treatment for refractory restless leg syndrome. Certain chemicals like nicotine and caffeine stimulate both the central and the peripheral nervous system, and they can affect the body long after being ingested. As a result, many experts recommend that patients with restless leg eliminate nicotine and avoid excess caffeine consumption throughout the day. There's some controversy, however, regarding nicotine. There's a case report of nicotine actually helping to alleviate symptoms in a patient. Another case report of exacerbation of restless leg syndrome symptoms following smoking cessation. However, the evidence for nicotine as a treatment for restless leg syndrome is otherwise undocumented. In addition, excess caffeine and nicotine can also contribute to insomnia, which can exacerbate already existing restless leg syndrome and can increase daytime drowsiness. Increased physical activity may be one of the ways for restless leg syndrome patients to reduce their symptoms. Risk factors for restless leg syndrome can include a lack of regular physical activity, a higher BMI, and obesity. A randomized control trial found aerobic exercise and lower body resistance training 3 days a week significantly reduced the symptoms of restless leg syndrome. Regular physical activity improved sleep patterns and it reduced the periodic limb movements, and thus it can be helpful as a non-pharmacological treatment. However, it's important to not engage in physical activity shortly before going to bed, as this can exacerbate the restless leg syndrome symptoms. Both massage and acupuncture can produce some benefits for people with restless leg syndrome. A comprehensive review found that more research is needed to determine the benefits of acupuncture, as only 2 studies were deemed suitable for the inclusion in the analysis, however. One study did find combining dermal needle therapy with medication and massage was more effective than medication and massage alone. Similarly, massage of the affected region of the leg provides counter-stimuli, and this can alleviate restless leg syndrome symptoms. Other massage techniques and enhanced external counterpulsation can also relieve the restless leg syndrome symptoms. Due to the presumed link between iron deficiency and altered iron metabolism in the brain and restless leg syndrome, one of the more common alternative treatments is iron supplementation. Various routes for iron supplementation have been studied as a treatment. Oral iron supplements have been found to significantly ameliorate the restless leg syndrome in patients with low to normal levels of iron. However, it's unclear if oral iron supplements are as effective for patients with no sign of iron deficiency. Oral iron supplementation is also beneficial for treating restless leg syndrome in the elderly, particularly those with low iron levels. Intravenous iron supplementation in the form of iron dextrin has also been found to significantly reduce the restless leg syndrome symptoms. Although intravenous iron may be more effective than oral iron supplementation, it can cause severe complications, including anaphylaxis. It's important to note that only those with a blood test verified iron deficiency should take supplemental iron. Ingestion of excess iron has been linked to cancer, atherosclerosis, and other degenerative diseases. Folate deficiencies play a role in the development of restless leg syndrome. Pregnancy often precipitates the signs of restless leg syndrome, and folate levels are of paramount importance during pregnancy for healthy fetal development. Researchers have also found pregnant women with low folate levels are more likely to develop restless leg syndrome, whereas women who take vitamins during pregnancy are less likely to develop the restless leg syndrome. Low levels of folate can also play a role in non-pregnant restless leg syndrome patients. Older studies have found folic acid supplementation can help to treat certain paresthesias and other disorders of the peripheral nervous system. Low levels of magnesium can cause neurons to become more easily excited, thus affecting a person's mental health. As a result, magnesium supplementation is often used to stabilize neuronal membranes and to prevent abnormal activity in the nervous system. Magnesium supplementation has been studied as a treatment for restless leg syndrome. One case study found that magnesium supplements were able to relieve the symptoms of restless leg syndrome and improve sleep. A novel form of magnesium, magnesium L-threonate, may be more effective for the restless leg syndrome because it's better able to gain access to the central nervous system. However, the impact of magnesium L-threonate on restless leg syndrome has yet to be clinically validated. The link between chronic venous disease and secondary restless leg syndrome is well established. Although it can be difficult to treat chronic venous issues, one therapy that's gained support is diosmin. Diosmin is a natural venotonic and it supports the venous function, thereby preventing or reversing some of the changes of the chronic venous disease. Although the effectiveness of diosmin for treating restless leg syndrome has not been tested, it remains a promising possible treatment. Horse chestnut tincture is used for venous problems. It was shown to be as effective as wearing compression socks. Diabetes is a well-known risk factor for secondary restless leg syndrome. However, less appreciated is the pre-diabetes, a subclinical elevation in blood sugar, and this can also cause the restless leg syndrome while remaining under the diagnostic radar of most physicians. A study examining subjects with impaired glucose metabolism unearthed a significant increased risk of restless leg syndrome. The restless leg syndrome affected 41% of those with pre-diabetes, while only 18% of those with healthy glucose tolerance experienced the condition. Maintaining healthy glucose metabolism, even for those not diagnosed with diabetes, might be helpful for restless leg syndrome. Even slightly elevated blood sugar can damage the delicate nerve cells and contribute to the unpleasant sensation called paresthesia. Green coffee extract with minimal caffeine content represents a powerful tool for people aiming to maintain healthy blood sugar levels. It can also help to control glucose elevation, which has been associated with the restless leg syndrome. However, this theory has yet to be tested in clinical trials. Often used as a herbal sedative, valerian root has shown promise at reducing the symptom severity in restless leg syndrome. In an 8-week clinical trial, supplementation with 800 mg of valerian root daily resulted in improvements in daytime sleepiness and restless leg symptoms. Additional data also supports the effectiveness of the valerian root in treating insomnia in post-menopausal women. For more information on herbs, supplements, and natural treatment plans, check out my website.